4 months into the pandemic, officials began publishing the weekly R number. It became the defining statistic for a government claiming to be guided by the science.
R is the average number of people one infected person passes a virus on to.
At the height of the pandemic, R was useful, describing in one statistic the number of future infections expected to arise from each new case. But from now on, says the UK Health Security Agency, while it will continue to monitor COVID, publishing R is no longer necessary. This time last year, we were approaching the peak of the Omicron wave of coronavirus infections, yet booster doses were only beginning to have a significant impact on protecting people. Yet the R number was exactly the same then as it is now. So how meaningful is that statistic anymore? Firstly, it's not that accurate a measure anymore, as the number of people being tested for coronavirus has dropped massively. At a peak at the end of last year, nearly 4 million were tested in a week. At the start of December this year, it was just over 100,000. Routine testing stopped as the threat of COVID waned. This week, around 1,000 people each day are being admitted to hospital with COVID, but that's less than half than at the beginning of 2021. And the number of people dying from COVID is now even lower, more than 6 times less than at Christmas last year.
If the situation were to change, were to deteriorate, then as long as somebody responds or the government responds, then that's okay. Publishing the data in the sort of granularity we have at the moment, we don't have for other infections like flu or RSV or indeed Group A strep. So it's not really necessary and not something we would normally expect.
Will a regular update on R be missed among those enjoying a Boxing Day walk?
I think it's probably about time. I mean, I think we kind of know that not as many people are getting it.
People are fed up. I think people just really want to have fun and they're just fed up with it.
I think having good data and having a good understanding of things as they're happening is always a good idea. But I think, there has to be some kind of understanding of what it means to be able to live.
Given other viruses are now of equal or greater concern in the UK, it arguably makes sense to shift some focus from COVID. But the surge of infections in China as it abandons its zero COVID policy serves as a reminder that this virus is far from done and tracking its spread remains a priority. Tom Clark, Sky News.